It's a system of care is a term of art. It's a framework. And as Erin mentioned, this is our second webinar in a series of webinars. So the first one was System of Care 101. And I'd encourage you to go to our website, txsystemofcare, spelled out, .org. And you can download that as well as this webinar afterwards. If you like what you hear and want to share it with others, please feel free to do that. One of the core values with the System of Care framework is including, encouraging, involving family and youth voice, and that family are there as equal partners and youth are there as equal partners. Family-driven, youth-guided are the cornerstones of a System of Care framework. And so it's not enough just to talk about that philosophy, but to really look at what are the practices that we're doing to include family and youth voice. Thus the name, Not About Us, Without Us. And so with that, I'm going to leave the biographical sketches to your reading enjoyment. You can go on the TexasSystemofCare.org website and see the background of all of our presenters. And so that will help us clip through and get to this wonderful panel of experts that we have today. And so the first part of the webinar is going to speak to family voice, and the second part is going to talk about youth voice and the importance of youth voice. So with starting with family voice, we've asked Barbara Granger, who's one of our family partners with the System of Care and the ASSET initiative. And the ASSET stands for, because an acronym buster here, whenever you're working with multiple agencies, family and youth, please be aware and be sensitive to using acronyms and explaining what they mean. So we hear SOC a lot, which obviously stands for System of Care, and then ASSET is Achieving Successful Systems Enriching Texas, and that's the initiative that is underway to expand the System of Care practice and framework in Texas. So with that, I'm going to turn it over to Barbara and ask her to set the stage for the importance of family voice. And then after Barbara, we'll hear from some other family members about some successful practices and promising practices going on in Texas right now that really involves family and includes them in developing and improving our statewide system. So with that, I'll turn it over to Barbara.
Look at the importance of family voice and family-driven care within systems of care, especially in the state of Texas. It's more than just coming to a planning meeting and sitting down with the case manager and going over a treatment plan and then being asked to sign it. According to the National Federation of Families for Children's Mental Health, family-driven means that families have a primary decision-making role in the care of their own children, as well as the policies and procedures governing the care of children in the community, state, tribe, and nation. This morning, you're going to be asked to answer a couple of poll questions. And so as we are going through this presentation, if you will answer them, and then we will collect the responses to give us an idea of actually what your agency, how important family voice is to the agency, and the family involvement level. So you see on your screen, just please answer those as we're going through. Why is family involvement so important? First of all, the needs of the child and family dictate the types of services provided. Families are partners and therapeutic allies. We are made sure that family-driven care is at every level, beginning with treatment all the way up through our state systemic changes. It empowers families to share in the decision-making and in the responsibility that the services at the service and systems level, such as policy making, management, and monitoring. Over the past 25 years, the role of the family has shifted from viewing families as a cause of their child's issues to being active participants in treatment and active participants in policy development and systems reform effort. Texas has been a part of this from the very beginning, having a representative in the formation of the National Federation of Families for Children's Mental Health, and continuing in building the family voice here in Texas and across our nation. There are many benefits to family involvement. Helping families develop a more positive feeling about their child's treatment and just improving parenting skills is at the very basic elemental level. It changes ways in which services are delivered. It ensures family voice has a full and meaningful incorporation. It helps us to remember that these are real families with real issues that we need to help them with. It's proven that outcomes improve. Family involvement ensures the work of programs and systems and agencies are relevant and effective. It allows the staff and programs to operate in the real world, noticing what works and what doesn't work for a family. It can increase community support, leading to expansion of programs. And communities are healthier as their capacity to better support families are enhanced. Erin, if you'll put the second question up, please. As we look at some of the challenges that we have when we have family involvement. One of the things that we want to make sure that we avoid is tokenism. It's not about just, having a family on a committee. We need more than that. It's not just saying, oh, well, we've done our job because we have somebody there. It's about bringing families together to really look at what's being implemented, some of the changes, what are some of the barriers, and doing that from a multiple family perspective. Sometimes there's a lack of clear understanding of the family voice and what their role is. Sometimes we don't really have the long-term vision of what do we want by bringing them to the table. What is it that we really want them to help us with? So having that long-term vision to know exactly why you're bringing them into your agency and what you want to accomplish through that. A lot of times there's a lack of resources available for without families being the driver's education. They need driver's education. What are the barriers? Childcare, toll in the treatment plan, then giving them that support, building their giving them the education opportunities, helps them to grow as family members, and then allows them to become even family partners or take a staff role within your agency. They also can be on an agency board, community collaboration, and then ultimately being change agents within the helping make statewide systemic changes. We need to remember that family involvement requires deliberate attention, dedicated resources, and the capacity building at every level to build an effective system. Thank you.
Thank you, Barbara. Really appreciate that information, and that sets the stage for hearing about practices that are going on that we have had successful family inclusion and family voice. And so the polls were interesting, I think, too, to look at and to see any type of governance structure or any type of work group that's overseeing a particular practice. that, you know, if there are families that are included in having a voice on those governance or those work group type of structures. So with that, I'm going to turn it over to Angie Jackson, who works with Via Hope, which is a statewide training and technical assistance center. And she's going to talk to you about the family partners and the use of family partners with a system of care framework. Angie?
Good morning, Sherry. Thank you. Good morning, everyone. I want to talk to you a little bit about one model that the state of Texas has adopted, which is the use of family partners and certified family partners. A family partner is a person who has parented a child with a mental, emotional, or behavioral disability. It can be the birth parent, the adoptive parent, the foster parent, or a person who has been chosen to legally step in as the parent to make all those necessary decisions for a child that is experiencing emotional difficulties. This family member can articulate their experience and hold the hand of another family and help them walk through systems to get the assistance that their child needs. And this is a very, very important position, a position that is very much needed in the systems that children have to access to receive much needed help. Currently, Via Hope is the agency that is the certifying body of certified family partners in the state of Texas. In April of 2011, we held an official kickoff weekend, and we had stakeholders from all across the state to come, and we sat down and talked about what we wanted our certification process to look like. And from that, work groups were formed and developed, and we had a curriculum work group, a training work group, a policy and procedure work group, and those work groups worked very diligently from April through July in developing the curriculum and developing the policies and procedures and in developing the training aspect for family partners to become certified family partners. So from May to July of 2011, all of that was developed. So we now have in place a policy and procedure handbook. We have a curriculum that includes 12 modules that are based upon core competencies that family partners need to become certified family partners. Between November of 2011 and May of this year, we've held 4 trainings. Those trainings have been held in Austin and Dallas and San Angelo and Corpus Christi. We currently have a training slated for August of this year, which will be our last training for 2012. And right now it is slated to be held in Fort Worth, and we are currently accepting applications for individuals to apply for that training. To date, we have 41 certified family partners that have went through a very rigorous 3-day training and showed competency by passing a state-approved exam to be certified. And they now hold 2-year certifications that will be that they will recertify for in 24 months. These individuals have really demonstrated their commitment to the field and what it really takes to be that person, that family member, to grab the hand of another family member and walk through this journey. We also have 3 homegrown trainers right here from Texas that were seasoned family partners that have been working in the field for quite some time, and now they're helping to train others to make sure that family partner services are delivered the same way all across the state. It is our hopes and our desires that no matter where a family goes for help, if there is a certified family partner aboard for that entity, then they will receive the same quality help from any certified family partner, no matter where they are in the state of Texas. And knowing that Texas is as large as it is, we know that that can be a challenge, but we are working very hard to make sure that no matter where families are, they have access to certified family partners, and those certified family partners are working to deliver much needed, valuable services in the same manner all across the state of Texas. So this is just one successful model that we have in the state of Texas. Thank you very much, Sherry.
Thank you, Angie, and appreciate that information on family partner programs that are available, to all the local mental health authorities around the state. And now I want to, and it looks like the questions that are coming up, that they're getting sufficiently answered with the chat box, with people chiming in. So there was a question of someone interested in becoming a family partner, and I would direct you to the TXSystemofCare.org website, and there's a way to email us, and we'll definitely put you in touch with Angie and Via Hope through that. That would be a nice portal. If there's any questions that you have that didn't get answered post-webinar, to give us a call or to send us an email through TXSystemofCare.org. So with that, I'm going to go ahead and kick it off over to Houston, to System of Hope there, and Pam Schaefer and partners to talk about the model that they've used in including families of their quality assurance process and looking at service planning and all. So Pam?
Okay, are we on? Good morning. We are adjusting our system. This was originally planned to be 3 parents and myself, and we've had allergy season hit Houston hard this time of year, and we have people down and out. So with me I have Julie Bourne, and we're going to talk about family involvement in Systems of Hope. Systems of Hope is the Harris County system of care. Okay, can you hear us now? Okay, good. Let me back up a second. Greetings from Houston. We are down in numbers because of illnesses, but we are committed to sharing our information. Systems of Hope is the Harris County system of care site, and we began in 2005. We are active. This is our last year of funding, but we will continue on. We have family and youth in our governing board. The challenge is always to change the professionals' thinking about how to incorporate families in the activities that they do. We have families on all work groups: finance, social marketing, continuous quality improvement, evaluation, cultural competence. This morning we're really going to focus on our continuous quality improvement, CQI, and evaluation. As I said, this requires an adjustment of professionals' thinking about how we go about conducting business. So the first thing you have to think about is your meetings and when they're held, and can families get there? Do they need daycare? Those kinds of issues. How are the meetings run? We tend to run our meetings using a lot of acronyms so that people don't really understand, unless they're part of the system, what we're talking about. So we had to think about that. As Sherry said, it's very important people be able to communicate and understand the language we use. It's been our policy to have families as co-chairs of all the work groups, so that there is actually a family and a professional that chair a meeting together. They work on the agenda, they conduct the meeting, and even take the minutes. What we found critical was to have that family voice to get real commitment and feedback from the other families that we work with. So I'm going to ask Julie Dorn to talk about her experience working in this area.
Hi, good morning. As a family member, family voice is a process that doesn't happen overnight. And when families are asked to participate, they should be mentored and trained so that their voice can be effectively utilized. I started with Systems of Hope as receiving services through their System of Care site. And while receiving these services, they had a program called Family Enrichment where we would gather, all families would gather, meet and greet, and talk about their experiences. And in doing so, I had a family member, Ms. Barbara Sewell, to approach me about being on System of Hope's governing board. And during this process, at a later date in time, another family member approached me about being on the evaluation committee. And she was also a family member. And her name was Eileen Chappelle. And I lost my train of thought. Once I was established on these committees, I was able to become more informed on how System of Care worked from the other side of just not receiving services, but how the program actually worked. And I became very interested in how the whole process, and I eventually became a member on every work team, as well as their governing board. I took advantage of all the trainings that were available to me, also the conferences that were held in and out of town, and I just wanted to learn more and more. And in doing so, I was able to myself mentor and recruit other family members to the table. It gave me a sense of purpose of being able to give back to families the same way I was able to be helped. And you feel that you have a voice, your voice matters, and it makes a difference. Some of the benefits of working with professionals is that you can make a long and lasting friendship. And by my voice mattered, I was always asked from other agencies and organizations to sit on their boards and be a voice in their agencies. And also able to meet some very influential people along the way.
So in reference to continuous quality improvement, Julie, you want to talk about how did we go about getting family feedback?
As being part of every work team, I was on the continuous quality work team where we decided we needed to come up with a survey that we can get feedback from families to see how System of Hope was actually providing services to families. And in doing so, the family members and the professionals sat down and created a caregiver satisfaction survey, which we developed. We were trained by evaluation team to collect data from families, and we also implemented the instrument after we finished developing the instrument. We implemented it, we got the feedback, we analyzed it with professionals, and went back to our team with the results of what we received.
What we did with the feedback that we received from the satisfaction questionnaire is we figured out we needed to redesign how we worked with families. And so we formed a work team composed of the administrative team, professionals, and the family members who did the survey. And we sat down with a consultant and totally redesigned how we did wraparound, the forms that we used. All kinds of information was redesigned. And we implemented the Wraparound Fidelity Index. And Julie, you want to talk about that, please?
Wraparound Index was done through the evaluation team, which we were trained, family members were trained on implementing this wraparound fidelity, and the professionals and family members, seeing that the value of family experiential input and the work and development of partnership between family members and professionals in CQI, we as family members were able to work with the project director, the program supervisor, and the care team supervisors, and an expert from another state to develop a wraparound model that would increase fidelity to the wraparound process. In addition, we family members went through training with evaluators to conduct wraparound fidelity surveys of caregivers, youth, and facilitators of wraparound meetings. Through the combined input of families sharing experiences and family participation in the training of the care teams in the new wraparound model, and family input into helping develop new forms for the care teams, a wraparound model developed that increased fidelity to national standards across every category and even above national standards in some categories. Therefore, due to family involvement and utilization of family voice, a partnership develops between professionals, staff, and evaluators, and family members. This partnership can prove outcomes and services that satisfactorily meet the needs of families. In order for partnerships to develop, all prospective needs to be honored. Basically, no idea is a bad idea. And if that idea is not needed at this point in the process, then it is put in the parking lot to be revisited again. Also, that everyone, families and professionals, need to be able to state their fears or concerns. For example, if I'm afraid families may be having difficulty accessing services because of an agency's policy or practice, I, as a family member, feel comfortable stating my fear. By the same token, if a professional is afraid because of HIPAA laws for family members to be contacting families they are serving, then they feel free to express this concern. Through working together, listening to each other, and developing solutions to each other's fears and concerns, that partnerships develop and improved outcomes can be resolved.
One of the big challenges, excuse me, of the involvement of families in the system of care is overcoming a little resistance from the professionals. And I say little in that they actually bought into it pretty quickly. What we demonstrated was effectively training families in what they need to know. They can then implement and get the needed information for program improvement. And I think the biggest selling point was the results. Our first wraparound fidelity index was low. The second wraparound fidelity index after all this family involvement was fantastic and above the national average, as Julie said, on a lot of things. So that's pretty much how we did it. We'd be glad to share anything else if anybody wants more information. Thank you. I think we're back to Sherry.
Thank you, Pam. And thank you, Julie. That was great information. And looking at the chat line again, too, it showed that, there's some other communities. Fort Worth mentioned that they have families involved with their evaluation team as well. And so those are concrete models of utilizing Family Voice to improve your service delivery system. I know that there's community resource coordination groups that include families in the meetings. So again, the whole concept of not about us, without us, and how to incorporate family voice. Now we're going to switch hats a little bit and talk about youth voice, because a youth is old enough to have a voice. It is their life, as a matter of fact, that we're talking about many times when we're looking at service plans or developing plan of care. So I'd like to punt to Michael Cox up in the Rural Children's Initiative to talk about, why do it, what's importance of youth voice, from some other promising practices in the state with regards to youth voice. So, Michael.
Hello. Are we good on sound? All right, here we go. Well, thank you guys for letting me be a part, and welcome. My name is Michael Cox. I'm with the Rural Children's Initiative here in West Texas. We were a funded site in 2008, and so I get the chance of sharing with you guys the joy of having youth involved and why they have it involved. It's amazing that youth are those that we serve in adolescence, and yet this is kind of the new kid on the block as far as them being involved and having a voice within systems. And so we're going to kind of look at that. In my opinion, the place to get the buy-in and for youth involvement to be effective, it's got to kind of start at the top and come down from there. And so looking at how youth are valued and their voice valued within our governance system, our leadership system, is extremely important. And so we have a polling question that I want to start off with today. We'll look at that. It says, my respective governance structure values the involvement of youth within our system. If you'll look at that and see what is the value. You may not have youth sitting at the table right now, but is that value and that principle shown throughout your system, without that governing board, throughout that process, to know that having youth voice and youth involvement is an extreme important part of your system. Looking pretty good so far. And I know that governance system is going to look different in every system and every community, but knowing that structure and that value is an important part of it is extremely important. Thinking about youth voice, so we're still sitting about 60%, but I'll move on. If you think about youth voice, what I did is I took the national definition for youth guided. If you think about the system of care, values, and principles, the principle that's put out about youth is about the system to be youth guided. So I want us to look at that, and we're going to take and break that down to see how we're able to develop youth voice and implement it within our systems, and why that is important. And so if you'll look at that definition with me and entertain me for a second as I read, but it says youth guided means that young people have the right to be empowered, educated, and given a decision-making role in the care of their own lives, as well as the policies and procedures governing care for all youth in the community, state, and nation. This includes giving young people a sustainable voice, then listening to that voice. Youth-guided organizations create safe environments that enable young people to gain self-sustainability in accordance with the cultures and beliefs within which they identify. Further, a youth-guided approach recognizes that there is a continuum of power that should be shared with young people based on their understanding and maturity in a strength and change process. Youth-guided organizations recognize that this process should be fun and worthwhile. So there's a lot of work in there, a lot of things to be done, but to give us kind of a framework for why it's necessary to have youth at the table, why it's important, and the processes that can happen, that need to happen to make that happen, and see that it's something's going to continue on the funding source or beyond a process that it allows for the system to look that way. So if you look at the first portion of that, is that you should be empowered and educated. Empowered by what? By recognizing and utilizing their presence on all levels. And that, yes, it's a physical presence, that they are there, that they're a part of the process, but beyond just knowing that they're physically there, that they're an active part of the process. Empowered through their voice and listening to that voice, not just a great, glad you are here, but listening to that voice and then putting some feet to it, which we'll talk a little bit more about it later. Educated in how to develop and use their voice. it's one thing to look at a youth and allow them to be at the table and be excited that they're there, but giving them the purpose behind that voice, why it's necessary to have a voice, what does your voice mean? And so that governing agency, those on all levels, they can help youth know the importance of that voice by helping them develop it. Looking at the policies, educate on the policies. What are the policies, and why is it necessary for them to give voice to those policies? Treatment options, when they're looking at the treatment plans, what is it? Are they flexible? And then also on their role in the process, what is it? What is the youth's role, and what is the partnership going to look like? So we'll look at that a little bit further in a little bit in more detail. But I want to give you another polling question, and to see maybe where I would say one of the very basic levels on treatment, to see where youth are involved maybe within your system. So youth within my respective system. That polling. Sorry, Aaron, will you pull that, the polling question down? It's covering my slide. Youth within my respective system have an active role in the details of their treatment development. And this goes beyond youth just coming in and saying, hey, here's your service package, and this is the process, or go and choose a service package. It's allowing them to give voice and feedback to what it is that works for them, what they like to do, what they don't like to do, what has worked for them in the past, and having a voice in the development of that treatment process. It's on a very basic level of how to get youth voice, but it's also a great training ground to helping youth utilize their voice and develop their voice when it goes maybe to a higher level, whether it be on a governance board within the community or even on a national level. They're able to implement that youth voice and develop that voice within that process. So we look at about 60%. That says, yes, they do have an active role and an active process within that. So that's good. And I just saw that there's a polling question that said, is there a selection process? I think it depends on what your system is. And so whether or not you get to actually to select. But that's where maybe even a case manager becomes creative and says, how are we going to help you be successful? That's in working with that. That's a partnership with the youth and saying, look, this is where your needs are. How do we work together to develop that process? So it's just a constant communication and develop that buy-in and developing that partnership within a system with the youth being a part of that. So the next thing that was listed within that youth-guided definition is that it's sustained and listened to. This is extremely important to know that the voice isn't just going to be, hey, we fulfilled a system of care requirement, but that it's a value within our system. And so if it's going to be sustained, that means youth will stick around when they know that their voice has been heard and there have been feet put to that voice. And so one way to do that is to create a safe environments that are to help them express themselves and to know who they are and what they like to do. Educate the adults on how to do this. This is huge, is to know within your governance system, the professionals, any of those that are adults that are working with the youth, educate them on how to work with youth. And one of the best ways to do that is to use youth and say, help youth to know how do you communicate with teenagers, how do you engage them and understand what the environment should look like in order to do that. Have the conversation on both sides, because you don't just educate the adults on how to communicate with the youth, but you also educate the youth on how to communicate with the adults, how to sit in a governance board meeting, how to interact, what are the protocols that are within that process, educating the youth in that as they go so they can be more effective in utilizing their voice. Expand your understanding of youth culture. Huge. That's something that's changing on a consistent basis. And so if you're not connected with teenagers and working in the process, you will never know what the latest trends are and what's happening and what's going to be effective for working with teenagers. And understanding the role of adult and youth partnerships becomes a huge deal, because this is a partnership. And so we need to be able to view one another in that process, youth viewing adults that way and adults viewing youth in the same manner. And a way to do that, if you just wanted to start gauging right now where your system may be in involving youth, this is a ladder of involvement or youth voice that's within the system that's utilized to help you kind of get a gauge of where you are. And there are different assessments that you could use to assess your governance board, assess your agency, to determine at what level are youth involved. Unfortunately, we often end up either at the manipulation or even the tokenism 1 or 3, where there's youth sitting at the table, but they don't have an active voice. They don't know how to use their voice. They're just there because there was a mandate to say there needed to be youth there. And so, unfortunately, that's oftentimes where we sit. The great thing about that is they're at least there. And so we have youth that we can begin working with to show the importance of youth voice, what that voice looks like, and then how to actually implement it. Obviously, the goal would be, number 8, that we get to a place of youth and adult equity and that we're equality, and that we are both equal partners in what's happening, both have an equal investment in the process, working to the same goals for the betterment of youth, family, and children. Power. This one's kind of funny. Once we start talking about youth in the system and also working with families in the system, the same thing. I remember a professional here that we talked about youth and family having a voice in the treatment process and youth and family moving forward. And he said, well, that's why they come to us. We're the professionals. Unfortunately, that can be the traditional mindset. And so when you hear the word power, people get a little afraid of that. But what is power? It's shared amongst all players. If you all feel like you have equal power in the process, you've all worked to the better good. And so youth need to feel that as well, to know that they are empowered as well as they are respected within that process. The question does go back to say, does the word power make you nervous? If it does, there's something you may need to evaluate and think about. Your perspective of what power is and how you share that with youth needs to be reevaluated so that the betterment of the system within what you're working with has the best outcome for youth and families. And youth knowing that they have been empowered to give back and to really give feedback to the process and the procedures, I can guarantee a better outcome in your services and your system. Strength-based change process. One other value of the system of care, but looking at it and meet and respect them where they are. That's something that we say on a regular basis, but this is where it becomes extremely important. If you have a youth coming to your table that has piercings, tattoos, and smacking on gum, you've got to kind of begin where they are, not in a I've got to change or redevelop this youth, but meeting where they are and understanding that you can walk through this process together. Remember, it's a process. We've all been there as adults. We've all gone through a process in our life, and yet sometimes we forget that youth are still in that process as well. And so remember that in this process of working with youth and bringing them along the board, it's a process, and they have changes in their lives. They have times where they can be very involved and times they cannot be. But we've got to keep that at the mindset and know that that's there. As well as on the other side for youth, it's helping our youth understand that it's a process, that everything doesn't change overnight. But as we keep it and work in the partnership together, that things begin to change and things that can be better. So change is difficult for most, but what will be our approach? So looking at it, what will be your actual approach to looking at what is the change going to be within your system to involve youth within that process? It's a big deal, and how you move forward with it. Finally, if you look at the overall goal or look at the end of that youth-guided definition, you see it says if you don't enjoy it, why would they be there? Most teenagers, that doesn't mean that you have to throw a party every time that they're there, and every time you've got to go. Food is always nice. It's always great to have that there, but if there's not a level of enjoyment, even for the adult, why in the world would a teenager enjoy it? And so remember that the environment needs to be an environment that someone's going to actually be able to the students are going to be able to enjoy being there. Be cognizant of the youth culture, knowing what's going on with youth. Many times when I've worked with teenagers, we may have little gadgets and manipulators on the tables for them, those that can't pay attention the entire time of the meeting. Even within our youth meetings, we would have little gadgets on the table for them to play with. I didn't care if they drew. Some would even have their headphones on throughout the process, but realizing that their culture and where they are is extremely important. You'd be amazed at what they can catch when they have headphones on. And then why are they there? Look at the latter. I think it's extremely important for agencies and governance boards and anyone else to understand why are youth at the table? Why do we want them at the table? You need to evaluate that and understand that, because if you value youth voice, if you value them being there, you're going to make the adjustments necessary for them to be at the table and to implement their voice within the process and the system. And then show evidence of their input. If you're going to ask a teenager for their voice, consistency is a huge deal, and then follow through. And so if you want a teenager to come to the table, you ask them for their opinion, you ask them for their insight. Follow through, putting feet to that voice is extremely important. And so if you don't follow through with that, you're going to lose partners, some extremely important partners in teenagers, because it's an important piece of them. It's their lives. It's what they're working with, as well as the lives of their families and friends. And then for me, throwing the box away. I like to say when you work with teenagers, don't even have a box. Get rid of it, because each teenager is different. Their needs are going to be different. The purpose of why they're being at the table, their purpose, their individual purpose for being there is going to be different. And so how to involve them, how to have a good time, what's going to look like with a meeting. One meeting may be one way, the other may be another. But you've got to throw the box away and knowing how to involve youth into the system and the process and developing their voice. How you're going to do that, that may be through audio, maybe through art, whatever. But helping them develop their voice, you've got to be creative and you've got to allow yourself to think outside the box of the norms of things that you may have done before. So here's some resources for you. There's just some websites for you to go check out to help. The Youth Ladder is on that Free Child website. Youth Move National, you hear from some teenagers later and their involvement with that. Just a number of different resources that are out there to understand how to involve and why youth voice is important. I believe we'll have a webinar later in this fall about how to actually involve youth, and we'll get into more details on that. But you're really missing out if you don't have youth at the table in the process. Thank you.
Thank you, Michael. Lots of good points, lots of good chat in the background about how to support family and youth within our communities and within our communities of practice. So keep that going. At this time, I want to turn over the mic to Lauren Cohen, who's with Via Hope. And Lauren has been doing a lot of work in working with youth networks around the state. And I'd like to hear from her about some promising practices going on within and as overseen by Via Hope. So Lauren?
Yes, thank you. Hello, everyone. I hope you can hear me. I am Lauren Cohen, and I am the youth coordinator for Via Hope. I work with Angie Jackson, who spoke with you earlier about our family partner work. So I'm going to talk about our youth work. And I appreciate everything that Michael said, so I can kind of build off of that and talk about, you learned why youth voice is important and why it's important to have youth at the table. And I'm going to talk a little bit about different ways that you can capture and utilize youth voice at the different sites that you work at. So when I was thinking about ways to capture youth voice, they kind of fell on a spectrum for me, from informal to formal. And you can kind of think about it as maybe like more passive to active, or you can think about it as less structured to more structured. But like Michael mentioned, the ladders, there's also a continuum of different ways to capture youth voice and then utilize it. So on the slide, you'll see a couple of different techniques that have been brought up in meetings that I've been a part of when I've asked people, how have they captured and utilized youth voice. And one of the ones that I heard recently that was really interesting and kind of an easy way for people to get youth input and youth voice in the work that they do is to have a youth suggestion box. And they had specifically talked about putting that box at their site and having somebody be responsible for checking it and making sure that they're up to speed on what youth are talking about with their services, and also having people involved in implementing their suggestions. Like Michael said, it's important to have youth voice and to hear what youth have to say, and then you have to have that follow-through piece as well. So you're not just asking for what they want or what they need and then kind of letting it drop. You're doing that piece to also implement what they need, because they're going to remember that you asked and that you didn't follow through. So another thing that has come up a lot is asking youth kind of informally what they think about things, maybe sporadically asking them, well, hey, how do you think things are going here, or what can I do differently in order to support your work and support your care. And that is a great way to really get youth voice and get them involved in their care. Like Michael was saying, making sure that they're youth guided. That's kind of an informal way to do that. So and on up to, like on the ladder, creating youth-adult partnerships to make services more youth-friendly. Having youth involved on boards, having them involved in projects, having them involved in program implementation as well. So I wanted to have a polling question so I can kind of see where you guys are at and what techniques you are using in order to capture youth voice. And I will give you a minute or so to answer that. And this is just for me to see kind of what techniques you guys are using. And I would be interested to see in the chat box if you're answering what sorts of other things or what sorts of other techniques you are using to capture youth voice. I'm always interested to hear what people are doing, and I'm all ears for new techniques. So, yeah. See, we're getting stuff going. That's pretty awesome. Okay. Well, thank you all very much. I appreciate it. And is there a way? Thank you. All right. So thank you all for answering that. And we will see official results and what happened later on. Okay. So let's talk a little bit about my work and what I do. So part of my job is to help youth kind of organize and speak up about the changes they want to see in the mental health system. The other half of my job is to help providers and organizations and state agencies hear what youth have to say. I'm going to talk about that a little bit in a different webinar, hopefully. This one, I'm going to focus more on how I built my youth mental health advocacy statewide network. When I was hired, they weren't really sure what the youth program would look like, and I came in and said, well, why don't we do focus groups throughout the state with different youth to ask them what their perspectives are on mental health, like what are the barriers, what are some challenges people face when seeking services, what are their peers thinking about mental health, and same thing with advocacy. What are you thinking about with advocacy? Where are they at with that? And also, what do they want to see from our program? And from those focus groups, we invited youth to continue participating to build our program. And they had said that they wanted to have a weekend retreat or a weekend meeting of some kind that would address some of their interests around mental health and advocacy. Like, how do you stand up for a peer? Or I want to learn more about mental health. There was a big focus on, how do I take care of myself in this work? So I worked with them to get their voice present in that event, and we did that in a bunch of different ways. I held conference calls with the group to see kind of where they were at with themes and locations. We did surveys with the youth and asking them different questions about the event as well. And I also worked with a youth subcommittee to help me make sure that everything that we were doing was relevant to the youth, like making sure that they were involved in marketing and making sure that they were involved in choosing the presenters, making sure that they were involved in the theme, and making sure they were involved in running the event throughout the day. And this really catalyzed us to have a bigger youth mental health advocacy network. The youth who participated in the retreat said they wanted to continue on and have a group, and they're working out what that really looks like right now, but the group is really theirs, and I'm there as a support and a guide, and I'm always asking them, well, what could I be doing better, or what could I be doing differently as a youth coordinator? And, I'm here to support you guys, so, I'm going to provide structure, and I'm going to provide different ways for you to provide input, and I want this to be yours. So, for example, when we were talking about the groups mission. I gave them a couple of examples of what a mission might look like, and I gave them a definition for what a mission is, and then I kind of asked them and let them go free with, what do you think your group's mission should be? Because, again, this is yours, and this is really a partnership. And from the network, I have started to kind of input youth voice in different ways throughout our program, and also making sure that what the information that I'm getting from the youth is being brought up at meetings and is being brought up when we are planning other programs, and is being brought up during like policy discussions or at council meetings, things like that, so that, you know, it's not only staying just within what I'm working on, but it's also kind of moving outside, because when you can't be present at meetings, then, you know, I need to make sure that their perspectives are being shared. So let's talk a little bit about lessons learned. I think Michael talked a lot about the importance of training adults to work with youth, and not only youth being trained to be in meetings, but also how can adults make meetings youth-friendly. I think that is hugely important and something that can be easily forgotten or overlooked. So I think that has been a huge lesson learned, you know, as I'm asking youth to participate in different meetings and different things. It has been hugely important to make sure that the adults in charge are on the same page and are understanding why youth involvement is important, and also how to be youth-friendly. Another major lesson is it never hurts to ask youth about their perspective on things, and you have to have that follow-through piece like I mentioned before. You also have to be prepared to check your professional ego at the door. If you are going to ask youth for opinions on your work, then you need to be prepared to hear those opinions. And you need to be okay when they say, hey, you know, we meet at this time and I really need to meet at this time. Or the way that you talk to me sometimes, I wish that you would use these words and not this word. Or, you know, stuff like that, so that you are being aware of how you are as a professional in your youth work. So those are really my big lessons. It's always about making sure that youth are present, making sure that adults can listen to what youth are saying, that you are utilizing youth voice in everything that you do. It's about, you know, when I think about it, it's also about infusion, not just, you know, having random spurts of youth work, but making sure that they're involved in every level of what you are doing. So thank you very much.
Okay, time out. Okay.
We're trying to get it.
Yeah, we're going to adjust our camera a bit. Okay. Thank you, Lauren. Appreciate your thoughts, and want to go ahead and chat for a minute with a couple of our experts here that are here from a couple of youth that are here from the Alamo Area Youth Move, and MOVE stands for
Motivating Others Through Our Voices of Experience.
Motivating Others Through Our Voices of Experience. I've got Richie and Evan. And the Texas Federation of Families has been a big sponsor of the Alamo Area Youth Move. And so who better to hear from than Youth Voice themselves? So we're going to model that, and we just have a few questions that we want to ask Richie and Evan. And the first one, starting off with what does having youth voice mean to you? Why is it important to have youth voice? And Richie, I'm going to start out with the birthday boy today, and let's hear from you.
Okay, well, hi, I'm Richie from Alamo Youth Move, and to me, it's important for youth to have a voice of their own because without a voice, we would never really be heard at all. It's important to have youth talk about experiences and things that we have been through because a lot of the things that we go through, normal people wouldn't understand. Like when I say normal people, I mean people, who don't have a diagnosis. They don't understand what we go through on a regular basis, and it's important for us to have a voice. So, because the things we live through, it helps us have an input on decisions that should be made about youth. Like, it's important for us to have a voice so we can actually have an input, so we can actually let adults know what it's like for us to have a voice, what it's like for us to be basically youth out here trying to basically, speak for ourselves. That's basically how it is.
That's great.
Thank
I
you.
appreciate that response. Evan, do you have anything to add on that? Why it's important for youth to have a voice?
Yes. I think youth voice is truth and is firsthand experience. And I also believe we should be valued above all else in the decision-making processes for whether treatment plans, things at school, things like that. I believe honestly having a degree does not at all make you an expert in the field of making decisions for people with mental illnesses or understanding people with mental illnesses. It does help, but it really isn't the whole thing. It's not the whole. You got to have the whole thing to really be able to understand how to make the right decisions, and it's more personal to make the right decisions.
Well, I appreciate that. It's important to have your voice because you're talking about your life, right?
Yes, ma'am.
So with that, can you tell us what adults can do to help youth have a voice? And Evan, I think I'll come to you for starters.
Is that one? Okay. Well, I got quite a little bit right here. By the way, Michael, you did an outstanding job, and I agree with you 110%.
That makes both of us.
Yeah. Anyways, we think there needs to be a drastic change in school systems because most of the problems and troublemaking start at school. I say this partly sarcastically because what they see is a problem child when in reality we are judged based on stigma. Peers and teachers force us out, making us feel isolated and alone. Thus, my proposal to change the thin-aired atmosphere in schools is to have old and new teachers take a serious few-week course regarding information on mental illnesses, forming helpful strategies, learning warning signs, and positive reinforcement, ultimately ending in a therapist and his or her youth in a group class session of questions and answers, where the youth with the support, I was having trouble reading my writing, with the support of the therapist, can educate, answer questions, and help open their eyes to our world and the life we live.
Yeah.
And I was going to start it for option 3, right?
To start it for us, well, I guess what adults can do to help youth have a voice is instead of telling us what we need, instead of telling us, oh well, you need this medication and this medication so you can live normal. Really, what it is for adults to do is to really tell us for them to really stop telling us what their kind of normal is, because they don't have a diagnosis. We're not like them, basically. But what adults can do is basically stop talking and start listening more. Start listening to what youth really have to say, what's really on our mind. That's what adults can do to help us have a voice, because it just takes one person. You know how the old saying goes, like it takes one snowflake to cause an avalanche. But right now, you have, kids with mental illness. That's a bunch of, little snowflakes, but it only takes one of them to cause an avalanche. So what adults really need to do is just basically, have time to listen to the youth. Have a time and a place where they can sit down with you and actually really listen. Not really so much tell us how it is, what it's like to live out here in, the real world, what they call the real world. Well, they actually need to just sit down and be like, all right, well,
Our real world is usually more harsh than theirs.
yeah, pretty much, because what we have to go through on a normal basis is what adults don't see. What adults only see so much. Like Evan said, how it's hard at school for us, it really is, because, we have people telling us, oh, well, you're not going to make it, or, your diagnosis is going to hold you back, and this and that. And personally, I've heard that from adults all over. But what adults really need to do is just, listen. Is really what they need to do, is just listen a lot more. Listen to what we have to say instead of trying to guess and, guess what's on our mind, basically.
That's great. Do you have something else to add, Evan?
Yes. Well, I was going to start up a question for you.
I just want to reflect on that, because I think that was great when you talked about, teachers, and I'm sure that could be said for many other people that come in contact with you, that could get educated on how to be sensitive. But with the foremost thing being that of listening, you're given 2 ears and one mouth. So
I don't believe that it's necessarily sensitivity. I believe that it's knowledge that needs to be taught, and that they don't need to be sensitive to it. They need to know about it. They really need to truly know about it. And I'm gonna give out my number, actually, if anyone else wants to know more about my story and stuff, to give you guys a better understanding. But anyways, I'm gonna start out question 3 right now, right?
And that question is, what keeps youth from having a voice? So what prevents youth from being able to speak up?
When youth groups like ours don't have funding, which we're trying to get some more, we are crippled and we cannot continue to flourish. Stigma around treatment plans make it difficult to function, and people who shut us out of life-changing decisions that deeply affect us impair our voice.
Okay. Richie, did you have anything you wanted to add to that about what keeps youth from having a voice?
Yes. Actually, it is right here. What keeps youth from having a voice is the thought of trying to speak, but no one's there to listen. What keeps youth from having a voice is really also, the thought of, I don't want someone to look at me different. I don't want to be seen as, someone that, can't handle who he is, or, someone that people say, oh, well, look at that guy, he's a freak, or he's a loser.
Once they find out you have mental illness, you're pretty much put on a pedestal with 10 spotlights on you all the time when you're at school and stuff. And people will try getting you mad. People will treat you different. And when people treat you different, that actually does get you mad. When people expect you to be mad all the time, that actually does get you mad. And I believe it would get anyone else, a normal person, mad too. If people are always treating you like you're either stupid or you're going to blow up at any moment. It's like, if you treat me a normal person, maybe you'd see that I'm not as wild and crazy as you think I am. And,
That's the main thing that really keeps youth from having a voice is really a place where they can have a voice. That's what really keeps them from having a voice, is not having a place where they can express themselves freely.
Yeah.
Because other than that, the only time we really get to be ourselves is when we're at home or when we're around each other.
Yeah.
But other than that, say we're at school or say we're in a public setting somewhere and they know you have a diagnosis, you get so much more stares. People look at you a lot more than they would basically, some high school kid. They'll look at you and, like Evan said, the spotlight's on you the whole time. And people like to get you mad so easily because they know what, they know what to say, they know what to do because they know how to get you mad.
And if anything ever happens, like I was bullied into a lot of fights when I was in middle school, and but the funny thing is that I could get punched in the face first and stuff, but it's easier to blame the person with the diagnosis than it is to blame, both sides, or even say self-defense, or there's so many things like that where they rather would persecute the person that has mental illness than rather look at the cause and effect. Most of my life, especially in school, I believe school is the #1 problem for people with mental illnesses. And the cause and effect is, I believe personally that most people that have mental illness don't just randomly blow up out of nowhere in a school setting. I believe that oftentimes we are antagonized and pushed, and people know they're doing it. And when something does happen, it's blown out of proportion, or they're blamed for the entirety of it, not the other party. So, anyways,
So what I heard you say is there's a lot of stigma with having a label.
Yes.
And then and some of the things that are getting in the way is, just people being more aware and sensitive and all. So lastly, you've talked about things that are getting in the way. What are some good ways to ask youth to be involved? And I heard you were talking about with your youth move and having your strength in numbers of being with other youth. So you want to talk a little bit about that?
Sure. Okay. How to get youth involved? All right. It says.
Oh, you want me to do that?
Okay.
Ours kind of go hand in hand on this one. Strength is in numbers. Youth must come together to change the world and be heard. Together, our chorus of whispers form a shout.
And from that shout, we will be heard, our voices as one. And without a place to rally, there really is no good way to get youth involved. Because if you don't have a place where all youth can come together and actually be with people, there's really no.
It's too hard to get a voice.
Yeah, it's too hard to have a voice if you don't have one place where you can all rally together and actually be able to, talk about what's on your mind, be able to be who you are around other people and not have to worry about, someone saying, oh, well, look at that freak or look at that loser, It's kind of stuff like that. And the best way to get youth involved is to just let youth know. There are people that are like them out there, and like me and Evan. I mean, I'm proud to call him my friend because before I started coming to youth move, I wouldn't hang out with people like Evan. Music, stuff like that. But ever since then, the way I got involved with youth move was just, our director, Miss Patty, she kept asking me to come see the youth move, and I kept blowing her off. Yeah, miss, I'll come. Yeah, miss, I'll come. Finally, I did, and I guess you can say it was like that Breakfast Club kind of effect, a bunch of strangers coming in together with one common, interest. But, at the end, it was like a bunch of strangers came together and we became a family. That's how easy it is for us.
Yeah, I like to say that we're not really a youth group.
Yeah,
I like saying that. I feel like we're more of a family, really. I said that in my speech a while back then as well. Oh, okay.
So there's a lot of unity, it sounds like.
Yeah, very much.
And then you're able to make some changes, not only, it sounds like, with your own life, but perhaps within your community and how services are delivered and all, if you come together and are able to share and talk about your experiences.
Yeah.
And when groups work best, I think these times groups work best when everyone has much of the same common goals and driven by some of the same things. I think if there's too many people with too many goals that are ranging from on different spectrums and different areas, then I think that it makes it harder for the group to function. And Elmo Youth Movement pretty much all got
the same common interests.
yeah.
Basically, the best way I would say to get youth involved is to let them know that there is, a unity out there, that they are not alone, that there are people, actual, people that they can come and talk to who are dealing with the same things that they go through. And I think with that, that'd be the best way to get youth involved, is to let them know that there are people they can talk to about it that aren't adults, that are actually some kids who probably they go to school with, who they see as different at school, but when they come home and they see him at a youth group, they're like, wow, look at this guy. And it's just like that. That's the best way to get them involved, is to let them know that there is unity, there is safety, and there is, love and respect out there. All you got to do is come forward and show. So all you got to do is have your own voice.
Thank you very
You're
much.
welcome.
Thank you. And I'm going to try to get the camera turned. I want to go ahead and thank Evan and Richie for being here. Y'all did a great job, and appreciate hearing your voice and really giving us some take-home points to think about when including a youth voice. We heard earlier about how to include family voice. It's providing those safe environments and helping bring that voice to our system and to systems changing from an individual to a system. So with that, I am going to turn it back over to Aaron for some final housekeeping, and we really appreciate your participation. Hope that you've gained some knowledge from this webinar and look forward to continuing the series. Thank you.
Can I
Sherry, before you go, there were a couple of questions that the audience posed that I think that we might want to discuss right quick. One of those questions was, what is photo voice? And the other is, are there other Youth Move chapters in the state? I'm going to mute my mic and turn it back to you.
Okay. As far as other Youth Move chapters, to our knowledge, there is not any, but we're hoping that there's interest, and I'm sure that there's technical assistance available to help keeping, or starting Youth Move chapters or other youth networks. So I'm going to let Richie and or Evan talk about what photo voice is. So who wants to take that one?
Well, photo voice is basically what we do is we take a picture that has symbolism, right? But is very meaningful to us, and hopefully relating to either mental illness or diagnosis, stigma, something like that. And we write a brief little summary, like a little excerpt or quote or something at the end. And some of the pictures are very simple, just a plant, but they could have, it's very true, a picture's worth 1,000 words, so that statement is very true, especially in photo voice, and we have a lot of really nice photos.
Do you have anything to add, Richard?
Yeah, speaking of photo voice, it was actually a year ago this summer that we all, the youth move itself actually met, and it's because of photo voice that this youth move has actually continued. And I'm going to say for photo voice, it really is, a place where youth can be themselves. And photo voice is like Evan said, we take pictures with, our own cameras. We get our own cameras, whatever. We take whatever pictures we want, how many ever we want. And when we're done taking pictures and we meet for photo voice, we all basically talk it out, and we all decide which picture is best, which one is your best one, which one you can talk about. It's basically like arts and crafts, basically, but
Much
yeah, it's
deeper.
basically like that, but it's much deeper. It's a lot more, into you personal, because with your picture, it doesn't have to be just a certain thing that they tell you, okay, go take a picture of this and tell me what to write about. Nah, it's not like that. It's like, okay, here's your camera, go out there, find something that, motivates you or inspires you or, basically, yeah, that relates to you. And, when you're done, write it if it's your favorite picture. If it's not, then, you have other pictures to choose from. And, it goes on for a while. You can take as many pictures as you want. And then when you come to that favorite one you like that represents you the most, that's the one you get to put, your little summary under. And thanks to Photo Voice, that's how we all got together again. And we plan on doing it again this year. So if y'all need, any information, just call me or Evan or Miss Patty Durr, and we'll be glad to set y'all up.
That's great. So were there other questions? The Photo Voice actually was used with our Children's Mental Health Awareness Day as well, along with, there was a lot of creativity with Children's Mental Health Awareness Day and a contest that the Department of State Health Services conducted, and Photo Voice and some of those creative examples were used to really kind of tell a story. Very inspirational. Were there any other questions, Aaron, for our youth here?
No, I think that's it, Sherry. Thank you very much. And I'm going to go ahead and wrap it up. So on behalf of the Asset Steering Committee and the Systemic Care Initiative for the state